Welcome, my dear listener. Welcome back to Redoctoring. I'm your host, Dr. Diane, and this is the podcast that allows you to be a different kind of doctor. Today, I have with us a very special guest. This is Dr. Marshall Sithole, who is an anesthetist, that I networked with in private. You see how I always be telling you that you need to network? This conversation is a testimony to that. He started an anesthetic collective group called Quattro Anesthesia. And today we're just going to have a conversation about entrepreneurship and medicine, the intersection of that, and how he has navigated those two quite complex fields. How are you doing, Dr. Marshall?
I'm all right, you. Thank you for having me here. I'm good. I'm good. How are you?
That's good. I'm also doing well. I'm doing well. I'm really excited for this conversation. I think something that people have with regards to
Okay, let's get to it. I mean, stories my mom were telling when I was growing up that I used to pretend I was a doctor from a very early age that I don't even remember. So it's just something that I grew up in, something that I understood, only profession that really made sense, growing up. So it was not really a choice. I just grew into it. Yeah. Yeah, it was like I say, I'm trying to run away from the word calling because I don't know who called, but I grew into it. Like, I honestly it was the only thing that I was interested in. I mean, when you grow up, you hear other people talk about other disciplines and, the money involved, like engineer makes this much more and whatever. But, you look into it, but you're like, always come back. That's what happened to me. So medicine truly is my life. So, yeah.
and in university, which university did you study at?
University of Victoria undergrad. Then I did my diploma in University of Limpopo. I just finished my diploma in interdisciplinary pain management with UCT. Actually graduating next year, so I'm excited about that.
Hey, congratulations, congratulations. Let's tap into your
Thank
medical
you.
school experience. I think I've only had one male doctor here on the podcast, but I'd love to hear from a male perspective, how was medical school? Did you have any mental health issues? Did you find the course to be quite challenging in some way?
Okay, so the course was challenging. The course medicine is always, especially undergrad. There's a big gap between how you study for matric and how you study university. And I don't think matric really prepares anyone for that. Right? I also don't think it's only medicine. I think it's all these high-end degrees where you really need a lot of energy in studying. There's that big gap. So yeah, it was tough. I mean, my first year was really tough. Uh, but throughout the 6 years, I have one word to describe my experience, which is awesome. Right. And that came from, yeah, I really enjoyed my undergrad. I mean, put aside the studying and the late nights and the crying, that you cannot take that out of any part of any aspect of your life, right? In relationships, you're gonna cry, but doesn't make the relationship bad, right? At work, you're gonna struggle, but doesn't make work bad, you know? Same thing with varsity, I struggled, but it didn't make it bad. I had a really good time and I have far more good memories than bad memories, And the bad memories are always superseded by the good ones where I'm like, yeah, well, yeah, that happened, but whoa, I found good friends, I found love, I found mentors, some of them, you know, I learned so much. I became a doctor. So honestly, I had a good time. Yeah, that is true. Yeah, yeah, I agree with. Okay, so I have two answers for you. The first one is yes, I did other things, right? I mean, I was a rapper in undergrad. Yeah, yeah, I was a rapper. So, but then let me say this. Um, I don't think anyone in med school is like 6 years for most universities. I don't think it's a good idea to be in med school for the full extent of your study, right? And this is why, and it's an opinion, it's not a fact. It's just my opinion. The first 3 years of the med school were terrible because all you're surrounded by is just, people studying the same thing as you, the same type of stress as you. And most degrees, 4 years, you're done, you're leaving, you go. So the 3 year gap, I think it really gets through people, right? Studying for 3 years straight, it's really tough. But after that, fortunately, my family was very understanding. I explained to them that, look, I don't think I want to be in varsity, in breast anymore. They agreed. I went out. And that's when really life opened up. That's when really life became life, while I was still undergrad. Because that's where, I mean, you stay in an apartment where your neighbor is not a doctor, doesn't care about your study, giving you a whole different perspective on life, you know. They are working, you starting to see, you're sitting with a working class, and 6 years is a long time. By the time you finish, most of the people that you went to school with, right, are already working and they've been working for a couple of years. But you don't experience that if you don't stay with them, you know. So I was fortunate enough, half my academia, I was outside where what's the word I'm looking for? I was exposed to life outside medicine before I finished medicine. I don't know if I answered you correctly. Um, yeah, but I mean, those are my two answers really. Yeah. No, definitely you think about it. I mean, one of my good friends is an entrepreneur as it is now, and I met him in undergrad, right? So I don't know if I should say this, but medicine teaches you that medicine is everything, right? In reality, medicine doesn't even make, in reality, it's really nothing. As soon as you leave the hospital and you get in your car and you drive off, no one really cares what you do professionally, right? What they care about is the results, where you stay, how you live, how you treat other people, you know, and how is your impact on earth. Now, we are taught that our impact is greatest in a hospital setting, right? And that's what we know. That's why you find guys that are like professors, they're struggling with life. Uh, but you get other doctors who are like GPs and they're thriving. They get their medical degree, they get out there and they really thrive. You know what I mean? But a guy that would go academia, they do this, do a thesis, do this, they are professors. All they know is a hospital setting. Really, they don't do well. That's what I've seen with my professors. That's what I've seen with some of my friends, and that's what I've seen with myself. Again, it's an opinion, it's not a fact. How I think in terms of entrepreneurship doesn't come from medicine, really. It came from being exposed to other aspects of life. Mm. Yeah. So look, in the true sense, I mean, it's all great and nice to study and you get your A and you get your cum laude, right? Again, no one cares beyond that, right? So I would say go out, go meet people, go get drunk, go experience love, go experience, date someone outside medicine, you know, have friends outside medicine, have a weekend where you're not stressed about school. 6 years, it's really a long time. And in reality, I mean, we are both doctors. We know that after like the third year, you're so used to studying that studying is now second nature. It's easier. It's unlike first year, where the failure rate in first year is quite high and the dropout rate is high. But as soon as you do 50%, I mean, the other 50%, you're just cruising really, right? So that's the time where you really need to go out and meet people and hear what people think and see the world, travel if you have the money, have friends outside medicine. I'm repeating myself again, but you really need to step out and see the world for what it truly is. Yeah, and the university actually they should not allow. One thing like I keep on saying, yeah, no, you need to go out, you need to do this, but you also need to study. And if the university say, look, we are tapping ourselves, they need to do that. They've done their studies, they've have the literature to say we need to tappen up, then they need to tappen up. You need to tappen up as well. But that doesn't take away, you can't be reading 24/7, right? Irrespective of how difficult a course is, you still can't do it 24/7. Right? At some point, your brain needs to stop and reset. You can't just keep expanding it. So that's the point I'm trying to put. I'm not trying to say university should lighten up, right? But what I'm trying to say is with that expansion, you need to reset, let your brain come back, and then you can try and expand again. Yeah, definitely. Yeah, I do agree with that. So my internship I did in Vela Vela, here in Limpopo, right? Along R31 south from Polokwane. Um, oh, it was awesome. I got so drunk so many times. It was awesome, right? And that's when, you really learn medicine, like all the theory. Now you have to put it together and see patients. You have a bit of independence, obviously still under someone, but it was really nice. My concept, I went deep in rural, where I really saw the state of healthcare in South Africa. Really, really saw it, where you don't have things, people are dying. Actually, as Tom said, people actually thought I was going to be a pediatrician, but it was never really in my blood. I just don't like people dying. But I did not enjoy my concept. I enjoyed my internship. Interesting. I have a very good friend of mine, right? We wanted to be ophthalmologist, right? And this is where fate now comes to play. It really does, right? So we got together through, I think we were MOs, right? We went to the same place and we spoke like, I want to be ophthalmologists. Both of us wanted to be ophthalmologists. Now, obviously, rich time is difficult and quite competitive. So to get in, you needed a diploma in ophthalmology, right? So it's DO, right? And the person that was explaining this to us said DA, which is diploma in anesthesia, right? So we thought, okay. So we were confused, like, why anesthesia? maybe because they do their own blogs. We try to justify it. We went to do that diploma and we just failed that. Both of us. Today we are both anesthetists actually. So we just say, they were like, no, sure, we're not going to do ophthalmology anymore. So it was a fate, really, where someone just used the wrong letter and then we just fell into this thing and we just loved it and we just did it. So yeah, that's sort of how I started with anesthesia. Yeah. Yeah. Even when I think about it sometimes, I'm like, if I tell people this, they might not believe. So sometimes I have to call my friend. I'm like, yo, tell them how we became anesthetists. So yeah. It's a cute story.
So now, with regards to anesthesia, the last thing you mentioned was how you got into it. Were there plans to specialize, or was the plan always to start your own anesthesia collective?
No, the anesthesia collective came later after I was in the world of anesthesia. Yeah, the plan is always to specialize. I think academia is important. And as much as I keep on talking about so much world out there, academia still remains very important and it should not be underestimated. So speciality, yes. Masters, yes. It's something that should be done if you want to. It's not for everyone, obviously, but yeah. The anesthetic practice was never in my mind. Right. So Quattro, let me just give you a bit of background with Quattro Anesthesia. So I went to private practice, not because I wanted to, but because I had to, right? With the crumbling services, I felt like I was not doing enough. Too many red tapes in government, not enough things. Learning became stunted. And I'm impatient, Um, that's another reason why I went into anesthesia. It's fast. I give you a drug now, you react now, right? Uh, so I went to private practice. I was there for a couple of years, I think a year or two. Then my first partner came, actually was still in government, called me up like, yo, I want to come to private practice. I'm like, okay, come. But when we were there, and because I had the list, you know, so I would, throw a few cases towards him. But I also felt like, oh, and before that, other guys in private practice, I was talking to them like, guys, should we really be competing? When a new surgeon comes, should we like run to him, this is who I am, or should we just be together and this guy comes and joins us? Is that not better? But the guys in private practice were not really for that, you know? So when this guy came, and I gave up on that idea. So when this guy came and I was showing him work and, our relationship was okay. We were not friends, but we were okay, we're buddies. And when I sat him down, I'm like, yo, listen, can we not compete? Can we just share this work? He was like, yeah, sure, let's do it. And that was something happened that I did not expect. One, the workload just plummeted. It went, not plummet, it just shot up, you know? All of a sudden I had time, all of a sudden I could do other things, but the work just kept on climbing, right? So we decided, look, we need a third person. That person came. Obviously, we're doing some interviews, the whole shebang. Third person came, fourth person came, fifth person came. Now there's five of us, and that's how Quattro actually developed, through just thinking, but why compete? It was not an entrepreneur thing. It was just why compete? Why can't we just work together? Little did I know that we would be the biggest black anesthetic practice in Limpopo, right? Because we're currently the biggest in Limpopo, and we are innovative. We do things that people generally wouldn't want to do anesthetically, you know. So I'm proud of it as well. I'm proud of my team. I'm proud of this initiative.
Which is quite impressive. It's really impressive. Just for the listeners listening, which hospitals in Limpopo do you operate in?
Okay, so it's in Polokwane. Medicine Popo, Medicine Day Clinic, there's Netcare Poloso. Lewahomo, there's a med lab and private hospital there. And then Zani, there's Mediclinic Zani. And I have done some work in Wood Street private hospital. But I don't really want to mention it too much. Um, it's not official work. So those are the 5 hospitals that we work at.
So now with regards to you and your team, do you have, are all of you guys anesthetists? Or are you a mixture of anesthetists and also
Yes,
anesthesiologists?
we're a mixture. We are a mixture.
Okay.
So the last guy to join us actually, when we started this, he went to do his FC, and then he joined us afterwards. Yeah, so we are a mixture. But all of
Okay.
us are
No,
anesthetists, so a minimum. So to join us, you need a minimum of a DA.
interesting. I think partnership is the most underrated path to success in this life. I think a lot of people feel like you need to be alone in order for success to be valid. That if it's shared or if it's a portion of a big venture, then, people don't like that a lot. So I like your thinking around Quattro and how you have brought together people and you're all pursuing the same goal and you're all eating because you all have work.
Yeah, the reality is this: collaboration brings in more money than independence. Because what I bring, the next person may not bring, and they might bring something that I might not bring. So collectively, the pie becomes bigger and the reach becomes far more um, than if I'm just alone. And let me give you an example. Within our group, right, there are people who don't like thoracic anesthesia, right, and neurosurgery and neonatal, right. So we know that okay, now, but as a group, now that discipline can be done as a group, right? Because if I don't like it, someone else who likes it will go. So that surgeon will still be serviced, right? But if I was alone and I didn't like neurosurgery, so I'm just giving an example, and I didn't like neurosurgery, I wouldn't do it, because it's not something I enjoy, right? Maybe doing it during emergencies or something like that. But now because I have a group, a neurosurgeon will not be serviced by a quattro anesthetist. A pediatric surgeon will be a service. A gynecologist. I don't know if it makes sense. You understand what I'm trying to say? The
Mm,
reach becomes far more as a collective.
mm.
Right. Also, there's a great learning opportunity. You always learn from someone else, you know. And when you're alone, you really depend on your congresses and on the people that you know that might not be as close to you, right? But as a collective, you're in constant communication with these people. If there's something you don't understand, you call them. If you are stuck, you call them. The learning really doesn't stop. So it's not just a monetary thing, it's a growth thing, you know.
Earlier on, you mentioned how you did a diploma in pain management.
Yeah, so interdisciplinary pain management. Um, in, it's done in UCT. I did that, yeah.
Mm, okay. Is that something that you also do within the group, within Quattro, the collective?
No. So what happens with it is this is my baby. So the painting. So I also have a clinic, a pain clinic, right? So and that is like a subspecialty in anesthesia, right? So I'm branching into the world of pain, right? But it is so closely linked to anesthesia that I mean our responsibility is to make the patients comfortable post-op, right? So it's something that I'm doing independently, but it does work with Quattro. So it's not completely out. So there is some relation between the clinic and Quattro anesthesia.
Okay. No, it makes sense. I think anesthesia is something that in medical school, you just see people doping and people putting people to sleep and dealing with whatever happens in theater. the exposure of actually being able to run a pain clinic, that's something that I only got exposed to now as I interacted with you and I saw what you do as well. So that's quite interesting.
Yeah. I'm glad someone can see an impact.
I think impact is quite important in our line of work.
Yeah, true. I agree. Difficult,
Mm,
but I agree. It is.
mm. So now with regards to running a practice, how long have you been running Quattro and your own pain clinic?
So the pandemic is relatively new. I think this is now the third year. But Quattro Anesthesia is about 5 years, maybe 5 years.
Okay.
Yeah, could be five
No, that's
years.
actually quite long.
Not really. No, it's not. Time flies so much, especially, when we're starting off, right? The first year was so quick because you're still navigating, you don't know what you're doing, right? So there's a lot of hurdles that you have to go through. There's a lot of learning. Before you know it, the year's gone, you know. So it's really not that long. Look, Quattro still feels new. And that's why sometimes I struggle with the age thing. Like Quattro's 5 years old. I'm like, hey, really?
Mm.
Because there's still potential to grow. There's still so much we're still learning with ourselves, and learning with the group. There's just so much. 5 years is really not that long if you think about it. It really isn't.
I mean, that's
Yeah.
what parents say about their kids. When their kids are 5, they say, oh my goodness, I remember when they were born. So I hear it from that perspective.
Yeah, I understand that. Yeah.
What's the reality like of running a practice?
Yeah. When you hear entrepreneurs tell you what you see is not what you do, and that is true. So you see me in 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 theater. Let's say I'm with you, Diane, in theater, and you are operating, I'm giving anesthesia, and you can hear a call. Oh, there's a list. Okay, let's call, my colleague. Let's do this, And a lot of people come to me and like, but is that all you guys do? But before that, there are meetings that we have to attend. There's the admin, there's the fights within ourselves, different personalities. Now we have to uphold policies that we create within ourselves. And I can tell you now, to create a policy is something different, something that is a horror on its own, you know? So, and the everyday activities, it's a lot. But when you see me go walking into theater, like, oh, these guys are having it easy. It truly isn't. And this applies everywhere else, where you'll hear an entrepreneur says, I haven't slept in a week. And I'm like, really? But you look fresh, you know? I mean, the car you drive is dope. But in reality, he really hasn't slept in a week. He's not exaggerating, And the same would apply to us because it is a business at the end of the day. Yes, we are helping people, but it is a business and it should be run as such, you know. So it is truly difficult and it's not for everyone. We had a colleague that came in 6 months left. I was like, this is not for me, within 6 months left. So it's not that easy. It truly isn't. If you think about a personal trait, look, for me, it has always been learning. So my personality is always about learning, right? And not just learning academics, learning everything, learning different languages, learning different people, learning different aspects of business, and learning the business itself, right? So I always had an idea of we as doctors, we run medicine, right? But we are not the people making money out of medicine. And we are taught to not want to make money out of medicine because what we're doing, it's so godly. But that's wrong, right? Why must an engineer drive a Ferrari and not a doctor? Right? I mean, an engineer is doing something great. Without an engineer, I wouldn't be able to travel, isn't it? So, so with us as well, why can't we just be doctors and really have a good life? And anyway, historically, doctors were having a great life, right? Without even getting paid. The community was taking care of doctors. But now we're in a place where we have to take care of ourselves, right? So with that said, it's a matter of saying, look, I have learned, né? And from that learning, I needed to make this a business. So guarantee of success, if you go anywhere, there's no guarantee. I mean, there are statements that are out there. The bigger the risk, the bigger the reward, right? That statement is there for a reason, right? But with that said, don't jump, because not all doctors are having great lives, right? You need to do your feasibility. You need to calculate your risk, right? It's a risk, yes, but you need to calculate it. And that's why there are doctors who don't want to take those risks and they're comfortable in their little corner and they're fine and they're happy. And that's okay. But I'm not okay with being stagnant. I'm not okay with being the same as last year, right? So I'm always going to try and push the boundary. And that you see that in business, you see that in my anesthesia, always want to learn something, always want to know, oh, I read this, only 5 people in the world did it. Can I be the sixth? You know? So it's always about pushing the boundary. And that's in business. And that takes away the guarantee, unfortunately. You know what I mean? But you must also remember, this thing is not about money. Sometimes okay, it is about money, but there's also a personal thing to it to say, I've done it. You know what I mean? So some people don't have that drive, and some people definitely don't have that drive. And the high achievers, the game changers have that drive to say, I have done it. Even if you tell them, go do it and you don't want to get money, they will still go and do it. Because for them, it's about, I have done it more than the money. But we all know money follows achievers. So I think that's something that I have as well. I want to be one of the guys that have said, I've done it, you know, and that takes away the guarantee and sort of increases the risk. But it's a risk worth taking, I believe. Mm, yeah. And look, people, there's this thing. I mean, we black, right? We grew up where it's like, what if it fails? And I'm like, yeah, sure, but what if it passes? What if you succeed? You know? And people, you learn the most from failure. You don't learn the most from succeeding. You learn the most from failure. I mean, I failed in a lot of things. I failed in medicine as well, but look at where I am now, you know? And I'm still learning, and I'm sure I'm still gonna fail. But it should not deter anyone. Okay. First advice is this. A practice is not for everyone, right? You need to be sure that you want to practice and you need to be aware of what the practice can bring you, right? Now, a lot of people right now, they're on no, go just open a private practice, you do fine. That's not going to happen the first 6 months, because you need to start up, you need to get employees, you need to get known, you need to be mentally ready, you need to put in the work, but the rewards can be then. And starting a practice doesn't give it success. There's a lot of practices that open and close. Actually, there's quite a lot of them. So you need to be ready for the admin. You need to be ready for the grind. You need to understand the business aspect of medicine. And I think that's where really you will thrive, right? And you need to have a love for it. Now, if you want to go and specialize, obviously, I wouldn't say go open a private practice, a general practice. No, go specialize first if that's what you really want. But if you don't want to, then go. Unfortunately, right now we're in a world where doctors are unemployed. Hopefully that will change very soon. So yeah, most of us now are forced to go open those practices. So do that. It's much better than not getting anything anyway. But if you do want to go back to school and specialize, I believe in specialty far more than, I mean, we do need general practitioners. It's actually got a lot more specialists than general practitioners on a national scale when it comes to proper health.
I actually had a conversation with a friend about how you are most likely to be successful with a practice in a rural area as opposed to an urban area. Yes, there's the conversation about in the rural areas, nobody wants to be there really, but also because there's less competition. Do you think that's true?
It could be true. It could be true. Also, as a general practitioner, um, you are more likely to succeed in rural because you're a generalist, right? But in town, that's where everyone comes in for special care. Right? So as a GP, yeah, well, one, there's a lot of competition, but two, a lot of those patients you're going to have to push forward, because there's that much specialists around. I think that's one element of it. But yeah, competition is true. There really isn't. But also there isn't a lot of people in rural anyway that are going to come uh, and, and consult. So when we talk volumes, it might be better to be in town. But when we're talking about quality care where you are the first in line, then yes, rural would be a better place to start and you will actually thrive, I think. The cost of running a business there also would be much less than in town.
Well, it sounds like there's a lot of moving parts towards thinking about medicine as a business as opposed to just it being a job. And I think we need to have more conversations about that.
Yeah, no, I agree. Because at the end of the day, the guys that are making business out of medicine are not doctors. And it's not right. We are medicine, right? So these guys are coming to us and they get money from us and we view it as okay. That money should circulate amongst, my money should come to you as a fellow colleague and your money should come to me as a fellow colleague. But the end point for all this money actually goes to the guys that are not even in medicine, the guys in suits somewhere sitting, and I don't think that's right. I don't know about fairness, but I don't think that's right. That money should circulate amongst us and we should be the one to enjoy that money if we are the one putting in the work.
Do you not think that also testifies to the statement that we need a lot more doctors in the non-clinical spaces as well?
Yeah, we do. But the South African system is set up in a way that it's difficult for a doctor to move into that system, right? Because as soon as you do that, they're like, yeah, but how many doctors are gonna, like they always use emotions to blackmail doctors, and we always fall into it. But I mean, look, in politics, we have a doctor who's a minister, right? That's a good thing, right? And going down the chain, they should all be doctors, or at least someone in healthcare, but on a very high qualification, right? Um, and it should be like that. And fortunately for us, it's like that when it comes to politics. But when it comes to business, you'll find, for example, Netcare, maybe clinic, majority stakeholding there, it's not doctors, right? And it should be doctors and the minority should be non-doctors. But if you leave right now and say, look, I'm going to be a CEO of Mediclinic, your own friends will look at you funny, like, but what about your practice? What about, so we limit ourselves as well, if you understand what I'm trying to say. I don't know if I'm putting my point across correctly. I'm not trying to downplay anyone doing anything. It's a personal thing that I've seen and something that I feel should happen. we should get more doctors moving into non-clinical fields. Um, yeah, I agree with you 100%. And that's unfortunately what's happening in South Africa now. Decisions are made by guys who are not in the field at all. Listen, hopefully, yes. Growth. Yes. The simple answer is yes. We, so the goal now is to be the biggest, anesthetic group in South Africa. Not necessarily in numbers, but in reputation mostly. Um, and we want to tap into high-end procedures. We want to be the guys you want to call if you want to do groundbreaking surgery and you need an anesthetist. We want to be on the names of Simon twins being separated. That's the goal, right? And we are hoping to get there. It's not gonna be an easy journey to be known nationally and provincially as the guys. It's gonna be very difficult. Yeah, no, I hope. Yeah, no, if that happens, honestly, before I'm old, definitely don't wanna be 60 and doing such things in life, you know. Okay, so they can get hold of well, you can get hold of any of us really. But if you really want to contact us, you can call this number 015 004 1579. Ask for myself, and then we can take it from there. Yeah, yeah, definitely. I am. I'm just currently looking for someone to run it. I mean, constantly in theater, constantly at the clinic, meetings with Quattro and the admin behind it. I believe social media is not where I am. So, but I am there. You can find me, Marshall Benedict Sitole, but I'm really not active. But I am there. And other social medias, I don't really, I'm not really active there, so I don't even want to mention them. But LinkedIn definitely, I can try and find him. I have seen. That's why I'm thinking of getting someone just to run my social space, because I don't have the skills nor the time to do it. But definitely I agree with you. LinkedIn, big things are happening. Yeah. Oh, well, thank you for putting me here and thank you to the listeners for listening in. Yeah. Bye, guys.